Hello viewers, welcome back to our program, The Mythbusters from SWASA. We have today with us Dr. Vishnun Rao Veerapaneni, the consultant pulmonologist and allergist of SWASA Hospital, Hyderabad. Hello sir.
Hello.
Sir, today I would like to just ask you a very simple question, sir. Allergies. And when it comes to allergies, most of the people consider that when a patient is suffering with some kind of allergy, he is having some kind of weakness in immunity or some kind of lack of strength inside within him. Somehow, you understand, you see the patient day in, day out. So is there some immunity problem with the patients who are suffering with allergy?
You said the question is simple.
Yeah.
Yes. So so it's very common to think that a patient who has allergy is weak. A patient who has allergy has less immunity. A patient who has allergy is sensitive. These are the common terms used, framed, and stuck on the wall by the patients.
Yes.
And that will be in the kid's mind forever, that they are weak, that they cannot handle all these allergies. They can't go out alone, because they have allergies. They can't.
Social life is hampered.
They cannot, everywhere they'll have that in their back of the mind.
Fear.
Both parents and children.
Yes.
So that fear is there. That fear is there in the patients, and they're slowly inculcating in the kid's mind. See, actually, the immunity in that child is more than less. So usually our immune system fights in a very complicated way, but I'll simplify it. There are two types of immunities. Okay, Th1, Th2. Th1 is kind of good. That means your body fights only bacteria, virus, fungus when required, and it will not react to any unnecessary things like dust mites or all these irritants or other allergens. On the other hand, you have T2 type of immunity, Th2. This guy who is having allergy reacts to everything. He reacts to dust mite, he gets sneezing when he is exposed to some perfume or cigarette smoke. He goes out, someone smoking, he'll cough, sneeze, running nose blocks. So he'll suffer. It doesn't mean his immunity is less. His immunity is overreacting actually.
Okay.
So his immunity is hyper there. So it's unnecessarily reacting too much. That is how you can put it. But don't tell those patients that your immunity is low. That's why you're getting frequent colds. That is the common thing I see in regular practice. So many children will come.
Actually, it's reverse.
It is reverse.
Okay.
Reverse, just I am telling it. There's no study. But I'm just saying, at least they don't have low immunity. That is what I can tell.
Okay.
Their immunity is as equal to everybody's immunity.
Okay.
But it is overreacting to few allergens. That's why I'm calling it hyper.
Okay.
But it is not low. Or they are not weak, or they are not sensitive kids, but they are framed like that because of these circumstances.
Okay.
So even a person with perfume sits beside him while watching a movie, this fellow cannot watch properly because of this allergy. When he goes to fuel gas station or petrol bunk, also he'll have some difficulty breathing because of the petrol smell or diesel smell.
Yes.
When he goes out to play in the ground, also he'll have some breathing difficulty or cough because of the dust or sneezing. When he goes out into the grass or the ground, also he'll have some pollen allergy, he'll have itching, sneezing, running nose, breathing difficulty. And when he goes out in rain, also he has a problem. When he goes out in cold weather, also there's a problem. Ice cream, cool drink. So there are multiple things that this guy is actually allergic to. But that does not mean he's weak. That is the only point I would like to convey, because this is a common question I get every day.
Absolutely.
Is my child weak? Is my child having low immunity? Why is he having frequent colds? He is having it because he is overreacting to many things.
Absolutely.
He has a lot of triggers. He has a lot of allergies that we need to handle. So only then we will be able to treat him properly. So first diagnose what it is. So don't falsely label it as having low immunity. It is not going to be treated by antibiotics or nebulizers every single day like how everybody does. So that's how we get a lot of patients with many children who on regular nebulization or every week once cold or fever, antibiotic, all that routine story. That antibiotic is further going to increase his allergies. Allergies is going to become obese, more allergic. So we need to break this cycle. So we need to properly diagnose a case. So with history most of the times, but also with some tests. So definitely we need some tests in the hand to diagnose few diseases, including allergies. So this is very, very important to understand, So consult the right pulmonologist or allergist, then get evaluated, get a particular test done. Then you'll eventually find the solution, and you'll stop labeling your or naming your kid as sensitive or weak or low immunity, all that. Don't say that to your kids. That is what is going to be there in their minds.
Absolutely.
So I see so many kids, when the parents start talking, they'll be like this. They're slowly accepting it.
They become submissive.
They become submissive.
Absolutely.
So it's having a lot of impact on the child's life also. So I totally believe in good counseling as well.
Absolutely.
So not just because allergy is not just somatic. Soma means body. It's not just a somatic disease. It is a psychosomatic disease. It involves your mind, how you think, how you interact socially. All that is affected by allergy. Because of this background problem, they can't really interact so well with other people, peers.
Absolutely.
So allergy or asthma, all is a psychosomatic where there's a lot of thinking behind the disease. So you need to treat that as well, apart from this particular somatic or organic or physical disease.
Okay.
So maybe too much information for a simple question.
No, it's a wonderful information, sir.
So
And
that is the thing. So
absolutely.
it's not low immunity or weak or sensitive. It is allergy. Handle it properly, diagnose and treat. He'll be fine like any other kid.
So as you see, viewers, Dr. Vivek has given me a perfect right back. My question was not simple and his answer was also not simple. Having said that, we were discussing about the specific immunity problem which usually people think about allergy. But having said that, sir, just I want to throw one small incident which has happened recently with us. It's not only about children. I have seen recently a couple got divorced. The reason for the divorce,
because of the snoring problem in the nights because of nose blocks or any allergies as well.
The reason was, sir, when we try to counsel the patient, the story which came to us is that the patient who was female was not at all cooperating in going out with husband whenever he expects her to come out along with him, only because she was having some kind of allergy with the smell of petrol. And the husband thought that this is an excuse and she doesn't want to come out with him. So that is how, understand the life. Allergy is very simple disease, but if not treated, not understood properly, and if you keep those histories not clearly telling to the doctor, then it becomes a big problem to the life. That is what we as a SWASANs trying to help you out with understanding the disease properly. So over to you, sir. Any last
yes, see, there are many situations or scenarios, to call it shortly, like stories like this, but hard to believe, but they're true.
Absolutely.
There are many stories or things like this that happen with everyone who have allergies.
Absolutely.
So there's a story behind every allergy patient,
Absolutely.
and it has to be treated as early as possible in earliest part of the life, so that it will not impact them in any way, physically, mentally, socially, vocationally, anything. So I believe in early diagnosis and treatment, not blindly telling that, okay, your child has some cold or cough, he'll outgrow by the age of 6, he'll outgrow by the age of 12, he'll outgrow by the age of 13, is not, I would say, to my patient. That is what some people come to me and tell that my doctor. So that is not true, that is baseless. If there is allergy, you treat it. Don't wait for it to go away. This is not 1800s. This is 21st century. You need to be proactive.
Absolutely.
And you need to treat it. And why to let the patient suffer or a child suffer when there is good treatment?
Absolutely.
So that is the only point. So I think all this is for the awareness of them. So I hope they understood something out of it. And thank you so much.
Thank you, Dr. Vivek.